And welcome back to the Buckle Up Podcast universe with Brandon Rush and Mama Rush. If you guys your first time tuning in, I'm actor Brandon Rush. I've been in 81 TV shows and movies, and I launched the Buckle Up Podcast universe with my mom, Mama Rush. We have done 123 episodes. We are in 73 countries and 804 cities from around the world. And we are very excited about how we're doing, and what makes this show special is our guest and the listeners around the world that are tuning in. We have a global audience, and we are very excited about that. We literally have people from all over the world. So we're excited for Dr. Zack Meade to come on here today. I'm going to read Zack's bio from here first. You have to apologize for me looking down, but I'm going to read it here. Dr. Zack Meade is an anesthesiologist, resident, and medical educator known for breaking down medicine, healthcare myths, and hospital culture with humor and evidence based on insight. Raised in a relative poverty, in and out of foster care and facing long odds early in life, he built an unconventional path through military service, including work as a bomb squad technician and electrical engineer, before entering medicine. He now blends real-world high-stakes experience with clinical practice and research to translate complex medical topics into clear, engaging conversations. His work combines sharp satire and serious education, aiming to improve medical literacy, professional communication, and patient care. Did you like how I put that acting voice on there? Yeah, I always deepen my voice for acting roles. But we're about to have Dr. Zack Meade on here, and I'm going to pause it for a second. Let's see here. How do I pause? Resume record. Met. And it should be popping up here in 1 second.
Mm-hmm. Hey, how's it
Dr.
going?
Zack Meade.
Let's see. So, I've done these with my MacBook and with my phone, and I think my phone has better audio visual.
Okay, no worries.
Yes,
I can
it does.
give me 1 second. And welcome to the Buckle Up Podcast universe with Brandon Rush and Mama Rush.
Mama Rush here.
Sorry, I said her name. Today we have Dr. Zack Meade on here. Dr. Zack, thank you so much for coming on the Buckle Up Podcast today, Buckle Up Podcast universe today.
Yeah, thanks for having me, man.
Absolutely, man. I was looking through social media, and I was like, we love having people from all different backgrounds and from around the world. So I was like, I saw your profile. I was like, hey, this guy, I like what he's working with on his social media. It's funny. He's got these posts going. So I was like, let me see if he'll reach out to him and see if he'll come on the show.
Yeah, man. I just started doing that like a year ago, and I've had probably more fun with it than my viewers have. But
okay. Well, hey, you know what? I think what you're doing is amazing. I absolutely appreciate it. And then, Zack, will you actually say your handle for your Instagram too, so people can check it out as well?
Oh yeah, Dr. Zack. If you search Dr. Zack MD, you should be able to find me on all the platforms, or my full name, Zachary Meade.
Okay, perfect. Dr. Zack, today is all about you. I did read your mini bio that you sent me, but I want you to get into it with you. And first off, where are you from?
Well, I was born in middle of nowhere, Indiana, but my parents split at an early age. We moved to Florida, and so I call Florida home.
Okay, what part of Florida?
Panama City Beach or Southern Alabama.
Okay. Absolutely. And then how did you just kind of take us through your journey? So you were down in Florida, and then where'd you go from there? Because you've done a lot.
Yeah, man, I grew up in this like cycle of like addiction and violence, just to be honest with you, right? So my parents, they had a real bad split, and I was like finding my way, doing all the wrong things, right, that my parents were doing. And I ended up finding my calling. I found faith. I'm a Christian, and that's really what led me to, So I joined the military thinking, man, I'm going to join the military and I can save lives physically and save lives spiritually. So I was like, oh, I'm going to go be a bomb squad tech.
That seems saving lives for sure, but also putting your life in a whole lot of danger. A bomb tech?
Yeah, I scored well on this little ASVAB test, and so they're kind of like, here, pick your job, and I kind of narrowed it down to medic or bomb squad tech, and I was like, I can't deal with blood. Wow. And if I mess up, it's someone else's life on the line. But as a bomb squad tech, if I mess up, whatever, it's not my problem anymore.
Yeah.
I
just in that in general, Dr. Zack, did you not have any fear about that? I mean, you're the first person I know out of all my military friends that was a bomb tech.
I mean, I honestly, I think I was too young and dumb to have
Okay.
fear, which is dangerous. I was 17 when I joined up, but there's obviously fear. But as you learn your skill and your trade, you get more comfortable, right?
Okay.
Mhm.
And then, Dr. Zach, I do want to hit one thing earlier about that as well. So, with a lot of our listeners, a lot of them are on the younger end. One of the reasons that we started this was kind of help that younger generation with trying to figure out what they want to do in life, as well as tell your own story. What kind of made you think about joining the military, and then what branch did you go into as well?
So I was kind of in and out of foster care too growing up, and I had no like guidance at home, and that was I didn't know how critical it was to not have that
Yeah.
until once I started going to medical school and all these other places, and I saw how far ahead my peers were than me.
Mm-hmm.
And I think the difference was their home structure, right? So I thought I was actually dumb. I failed classes in high school.
Yeah.
I struggled with my homework. I did all these things, and it turns out I wasn't dumb. I just didn't have that guidance and that mentorship
Mm-hmm.
to
Mhm.
tell me what was important, what I should focus on, and to just give me a little bit of courage.
Mm.
So I ended up, I was on the wrestling team, and one of our coaches was a military recruiter. He was just volunteering his time. And
Oh
I ended
wow.
up joining the Army. I mean,
Okay.
Mm.
I thought that was, where the good Lord was leading me, and it
Mhm.
truly was.
Mhm.
Absolutely. And then I saw you mentioned faith. Like, is faith how you kind of found your grounding during that time too? Because I hear you mentioning faith, which is an amazing thing, and I want to touch on that too since you're were there. Did you have that faith going from in high school?
I found my faith in high school. So,
Okay.
and that's when things, my sophomore year of high school, I had actually the first month, I didn't go to school. I
Oh wow.
was on my way to being a high school dropout.
Yeah.
Mm.
My mom, I had just moved back in with my mom from foster care, and my mom didn't re-enroll me in school, and I wasn't interested in going.
Yeah.
And I'm like, hey, I'm kind of getting bored of this. I want to go live with my grandma. And my mom's like, okay, fine, but school started, up there, a month ago, so you got to go soon, I guess. And so we're like, okay. So 24 hours later, I was on a bus, and on that bus, I've actually never told this publicly, so it's
Mm.
kind of funny. But on that bus, there were these three soldiers that got on somewhere in Alabama. There was a bus stop because I was moving in with my grandma up in Indiana,
Okay.
and they had just gotten out of basic training. Heads were shaved, and they were like, "Man, the army is the worst thing in the world." I had long hair, by the way, back then, and I had
Okay.
piercings and stuff. And I'm like, yeah, you guys are right. I would never join the military. Well, spoiler alert, I've been in for 15 years now.
Okay.
Uh, but that's what that was the start of that God, what I call a God wink, or these coincidences in life. And when you speak something out and you say, I'm not going to do it, God has a sense of humor. And I'm like, I'm never
Absolutely.
joining the military.
Yeah.
And then I move in with my grandma. I start going back to school, and then I find my faith. My grandma brings me to church, and that's really what led me on the right path. And then I ended up joining the army.
Okay. And then Zach, when you joined the army, now question: did you? Because it sounds like you're using the GI Bill too. I guess did you do like time in the army, or were you going to maybe college too at that time, or how does that? Or you were
Yeah, I
in
was
high school?
active duty. Yeah, I did
Okay.
4 years active duty EOD, and then I EOD is explosive ordnance disposal. I did
Mhm.
night classes. As soon as I got to my first duty station, I was just taking night classes and online classes, and I did well because I wanted to learn. Like I had the motivation, right?
Yeah.
Mhm.
Okay.
Yeah.
And
Zach, I just have to ask a question. This is Mama Rush here, and using my picture today because I didn't feel like putting on makeup this morning. But I want to ask you about that foster care. How was that experience, and how long did you stay in foster care before you went to your mother? I understand you went to your mother, then you decided to go to your grandmother. So, how long was that stint in foster care? Because we have taken in a kid from foster care. Um, Years back, and he turned out to be a wonderful kid, a poet and everything now. So how was that experience for you? Because a lot of kids find themselves in that arena right now, or that area of life.
Yeah. Well, first of all, thank you so much for taking in that foster kid. That's a good success story. I was in foster care a few times when I was younger. When I was 2 or 3, I can't even remember, and then living with other family members. I was in foster care in, I think, 6th or 7th grade for a year. Got
Hmm.
back with my mom, and then in 8th grade, uh, went back into foster care for a solid year. And
Hmm.
that's actually those 2 years in middle school, 6th grade and 8th grade. in
Mm-hmm.
foster care were the most stable years of my entire life, almost.
Okay. So the parents or the homes you went into were beautiful homes, beautiful places. We hear all kinds of stories about foster care, but I know when we took our kid in, well, he wasn't our kid. He became our kid. Actually, he became a big brother to Brandon and also my older son David. So, and he just wonderful. He'd come and he had a great weekend with us and everything. And then he would come on weekends, and then we just had so much fun. And that experience, so it seems like the foster care homes that you went to were very good homes. Is that correct? For the year you said
Yeah.
stability. So that's great because we have a lot of young people facing that right now on the
Mhm.
podcast or listening to the podcast, and to let them know that some of the horror stories they may have heard, you've had a great experience. And so I'm glad you're there. You're here to actually share that. So keep on going on about this army thing, and then we're going to go into that medicine thing next too.
And then Dr. Zack, actually, I'm going to touch one thing too.
Mm-hmm.
Sorry, because we're here right now. I want to make sure to mention
Yeah.
it.
Mm-hmm.
What kind of words of advice would you have for kids that are going through that kind of similar situation,
That's right.
or either in foster care or having difficulty at home? Because obviously you found a way to keep yourself encouraged somehow. So I just was hoping that you might just, if you had any words.
Mm-hmm.
Yeah, I did find myself at many times at the age of 13 and 14 being super depressed, feeling unloved and honestly
Mm.
not wanted. It was tough. And again, this is something I've actually never shared publicly, but when you find yourself in that position, when you feel that way, like
Mm-hmm.
there's nothing left to live for, there is. If you're at the bottom, the best thing about being at the bottom is it's only uphill from there, right? It only
Yeah,
gets better. The views get better.
Mm-hmm.
And you can get to the top. You just find your motivation, find your faith, find the thing that drives you, and you're going to make it in
absolutely.
spite
And
of everything.
amen. Amen. Dr. Zack, thank you so much. Now you can go into. I thought that was important to hit because
Yeah, that is
and thank
important.
you for sharing that with us as well. So yeah, go ahead, Zack. Going into the army, like one day you just decide, hey, I'm gonna. Because you said that at first you had long hair, you had piercings. You're laughing at these, not laughing, but you see these guys are saying, man, they go to the army. How does this get you to go? Like, oh, because you said your coach or something, the wrestler.
Yeah. So I had this coach in high school, and
Mm-hmm.
I was like, again, I thought I wasn't very smart, so I'm like,
Yeah.
I'm not going to college. That's not for me. So I joined the army. I'm like, I want to do this bomb squad stuff. I want to be the best I can be, right? And I love it actually. I'm thriving in it. I'm doing well. I get promoted pretty early on, and
Oh wow.
it's going great. But I get married.
Okay.
Best thing, right? Second best thing that's ever happened to me.
Yeah.
Next to my faith.
Yeah.
Uh-huh.
Don't tell her I said that. You
I won't.
can't. But then I get to this point though where she actually gets into pharmacy school.
Oh really?
And yeah, where I'm at, I'm actually stationed in Louisiana.
Okay.
And I have to either stay in the army, stay away from her for 4 years,
Yeah.
or I have to get out of the army and move with her to pharmacy school. And I'm pretty sure if I had chosen to stay in the army at that point, probably would have ended up in a divorce. It's just so hard.
Yeah.
So everything really worked out well. So she got into pharmacy school at Creighton up in Omaha, Nebraska. It was a great program. And I decided to get out of the army, but the Air Force had a reserve unit right there with the same exact job I was doing in the army, the bomb squad.
Yeah.
And so not only was I able to transition from the army to the Air Force, they gave me a sign-on bonus. I kept my rank, everything.
Holy smokes.
Yeah, it was great. And so it worked out. So I joined the Air Force next.
Yeah. And then, well, Jesus, sorry, man, you're probably some of the most interesting people we've had just in the first few minutes of starting this. So you go up to Indiana, and now your wife, I guess your fiance or girlfriend at the time, was in school for pharmacy, and so now you guys are. First off, how did she feel about you being in the EOD as well?
Well, we met in high school, and it was funny. But I got stationed. I was actually stationed in Florida for a while, and so we reconnected.
Gotcha.
Dated while I was in the army. Ended up getting married. Right before I got out of the army. She was supportive. So you have to be, if you're a military spouse and you're not supportive, you're probably not going to be a military spouse for very long.
Absolutely. And so, how do you get this transition of now you're doing EOD? So you work the same job as EOD. Now, how do you get this thing like, hey, you know what? I want to go be a doctor next?
So I'm doing the reserves, and I kind of switch back and forth from active duty to reserves with the Air Force, and then I'm still the whole time I'm taking night classes, online classes, or going in person as I can.
Uh-huh.
And again, I thought I was dumb, so I'm like, I need a degree because everyone said I needed one.
Yeah.
I mean, yeah, that's like the next thing, right? Everyone's like, oh, if you want to do something better, you got to get a degree.
Yeah.
So I'm like, what's the easiest thing I can do that like might pay well and open up options? So I'm like, civil engineering. It's like you get engineer, but
Yeah.
civil, it's not as hard as like electrical engineering, right?
Yeah.
I don't know. So I just start going to classes, and I'm like, can I do this? I get an A in calculus.
Holy smokes.
I get an A in calc 2. I get an A in calculus 3. And I'm like, maybe
Yeah.
I'm not dumb. Maybe I just didn't have anyone to help me along the way.
Yeah.
And so I graduated with my associates with a 4.0. And then I ended up, when I realized I'm not dumb, I don't want to do civil engineering.
Yeah.
I just chose that because I thought maybe I could. So I switched to electrical engineering because I wanted to help veterans. I wanted to make medical devices and products
Uh-huh.
to give back to these wounded, bomb squad techs that lost limbs and stuff.
Yeah.
Mhm.
So I studied electrical engineering, and at the same time, I decided to be a volunteer firefighter and EMT. And there's not a lot of fires actually nowadays with the fire protection system. So most of the calls we got were medical.
Okay.
And I ended up loving the medical side of things. So I'm like, how do I do electrical engineering and medicine?
Mm-hmm.
So I'm like, well, why don't I go to medical school and then I can be like a doctor that makes medical devices? So
Uh-huh.
that's what I decided to do. I started taking the prerequisites while I was doing my electrical engineering degree, and finished all that. And right before I finished, a brand new medical school opened up called Carle Illinois College of Medicine.
Okay.
They're on the campus of University of Illinois, so they actually had another medical school there. So it wasn't like some random, campus.
Yeah.
And their whole thing was they were recruiting engineers to go to medical school to be physician innovators. And I
Mm.
applied, I got in, and they offered me a full ride scholarship.
Holy
Oh,
smoke.
that is
Heck yeah.
one.
Yeah.
And how long did that program take?
Oh,
That
you
was
tell us about that program. Mhm.
amazing. That's amazing. How long was that program? Or how long is that program? Are you still in it currently?
No, it's so 4 years, which is a standard medical school length. But one of the differences, we pretty much went the entire year. A lot of medical schools, you get 2 or 3 months off for the summer.
Mhm.
Mhm.
And we were pretty much in school the entire summer for pretty much all 4 years.
Okay.
Yeah. But it was good. It was a good time.
Oh,
And that's obviously probably, I feel like that's probably like a regular easy transition for you, because if you're already doing the military, like full time or reserves, you're used to that kind of. You already have that because you went to the military so early. I guess you would already have that discipline in you.
I think that's critical, actually. A lot of my peers and people before me, they're like, oh, med school's so hard.
Yeah.
And it's not easy by no means. But I think the people that struggled the most were those that went from high school to college to med school,
Mhm.
and they never had a career or actually faced true adversity, right? For me, it was just like, all right, I just got to buckle up again. We just got to do this again.
Absolutely. I like how you use buckle up there, by the way.
Oh,
Thank you for that. And so, Dr. Zack, what is it exactly you do now? Explain it to not only just us, our audience, but we have we have teens that are listening to our show as well. How would you explain what you do or the type of doctor you are?
So I graduated medical school in 2022, and I started after medical school. Nowadays, you have to get a specialty. So I went into anesthesiology residency,
Okay.
Mhm.
and that's 4 years long. And I'm finishing up. I got about 6 months left, and I finish up. And then I'm going to be my own attending physician, is the term, right? So you're a medical student, then a resident, and then an attending physician.
Okay. First off, congratulations on all that you have accomplished and with that as well. And then with the specialty, then why did you choose that specialty of anesthesiology, for instance?
Mhm.
Yeah. So anesthesia is a wonderful balance of work and life. It's a life-saving specialty that's hands-on.
Mhm.
It pays well, but it's shift work where a lot of other medical specialties aren't, right? So at the end of the day, I can kind of leave work at work. And
Okay.
I actually started off doing surgery. I did my first year in general surgery.
Okay.
And I remember I came home, I had my second kid during that year, and my oldest son said, Dad, why are you here? Why aren't you at work?
Mm-hmm.
Mm.
And that broke my heart because as a
Mhm.
surgery resident intern, you're working 80, 90, 100 hours a week. And
Mhm.
I realized that I valued my family more than I valued my job.
Absolutely. Hey, amen. I understand that, man. You got a good head on your shoulders. You definitely have a great head on your shoulders.
And when I hear you talk, excuse me, Brandy, you want to
Oh,
finish in with
oh no,
what?
you're good, mom. You're good.
Yeah, when you were talking about anesthesiology, and it's often invisible to the public, and that's why you said you had certain schedules. What do you wish patients really understood about anesthesiologists do before, during, and after surgery?
In general, uh, before we do anesthesia on you, we've looked at your chart, we've looked at your medical history, we've looked at your
Mm-hmm.
imaging, your tests, we've probably talked to your surgeon as well, and we've
Mm-hmm.
devised a plan to keep you safe during surgery.
Mm-hmm.
Um, the day of, we're going to meet you, tell you about all the risks and the benefits, and then we're going to, induce general anesthesia. We're going to put you to sleep, and more importantly, we're going to wake you back up, and we're
Mm-hmm.
going to monitor your vitals the whole time. And the thing that I want you to know as a patient is that when you're undergoing general anesthesia and having surgery, honestly, the
Mm-hmm.
general anesthesia part of your entire experience is probably the safest part of the entire day.
Oh,
Generally, if you're healthy,
mhm.
anesthesia is safer than riding in a car.
Oh,
Really?
okay. Okay. So that's
Absolutely. Absolutely.
No one freaks out when they get into a car and get on the interstate and think, oh my God, I could die.
Yeah.
But
uh-huh.
you're more likely to die in a car than you are under general anesthesia.
Okay. And then after surgery, what should a patient know about the side effects of the medicines they received from you? Do you go into that with patients?
Definitely. And that to answer that question, it's really patient dependent. So for, our younger population, little kids, which we work on,
Mhm.
they might be really confused and cry and kind of sleepy and drowsy the whole day. When you're an adult, just a middle-aged adult, honestly, you'll do pretty well. You might have
Mhm.
some nausea and some vomiting. You might have a little bit of brain fog or confusion for a few hours. And then
Uh-huh.
for our older population, as you're over 65, excuse me, let me say for our wiser population, um,
That's right. All right. Go
Yeah.
right ahead.
you're more likely to experience a little more cognitive delay and brain fog and stuff,
Uh-huh.
right? So that's some of the things I prepare you for. If you're confused for a couple, hours or days, that's to be expected.
Absolutely.
Okay.
I'm sorry, mom. You about to say something?
Yeah, I was going to ask one more question
Yeah.
along those lines. And because I want to dispel myths that people might have right now. Since we have the expert, you, Dr. Zack, on the phone, what is the common myth you hear about anesthesia, pain control, or being put to sleep? And what is the evidence based truth on that?
When it comes to pain control, so this is actually a question I ask whenever I started anesthesia. If we're putting people to sleep and they're unconscious,
Mm-hmm.
why are we also giving them pain medications while they're asleep?
Oh, okay.
Because if you aren't aware, what does it matter?
Mhm.
Well, when you experience pain,
Uh-huh.
if you're aware of the pain or not, your body has a physiological response. Your heart starts racing, your blood
What?
pressure gets up,
Uh-huh.
you release the stress hormone cortisol, right?
Uh-huh.
And if you do that for hours, right? Let's say a surgery is 4 hours long and you're not treating their pain, even though they're not consciously aware, their
Uh-huh.
body it's gonna be like running a marathon for those 4 hours for the body.
Oh,
Wow.
And it's gonna wear the body out. So that's why we do give, opioids and other pain medications, ketamine, Tylenol, ibuprofen, or it's Toradol, all these things, even
Uh-huh.
during the surgery and then afterwards, so that we're controlling that stress response your body's going through.
Oh, that's good to know. That's excellent. Excellent point. Okay, Brandon, you have
absolutely.
a question? Go ahead.
Yes, I do. And because you're anesthesiologist, I had to. I don't usually do this, but you're more technical, so I had to pull up some paper questions here as well. So, Dr. Zack, most people think that anesthesia is just putting people to sleep. What do you wish the public understood about what you actually do?
Um, let's see. So I think there's a few things, a few interesting points. Is one, can you dream under general anesthesia? And the answer is yeah, you can.
Hmm.
Really?
Yeah, not everyone does. It
Yeah.
depends on the level of anesthesia, right?
Mm-hmm.
But you can have a dream. I think a lot of people refer to it as a medically induced coma and stuff like that too. I wouldn't refer to it as that. It's general anesthesia. It's very safe. We already talked about the risk profile of general
Hmm.
anesthesia versus if you're a healthy. This isn't for everyone, right?
Mm-hmm.
If you're a really sick person and you have heart issues and all these things, this isn't you. But if you're a generally healthy adult, you're accepting more risk every time you get into a car than you are going back to the operating room with a an anesthesiologist.
Okay.
And most of the risk comes from the surgery part of it, not the anesthesia part. For an otherwise healthy adult, there is, I think there was some research in the early 2000s. Actually, let's talk about anesthesia with kids, that if kids undergo general anesthesia multiple times, they're going to have cognitive delay, declined IQ, and all these things, right? And the research has been published, and the jury is pretty much concluded that you'll drop maybe like half an IQ point or something like that. And the point there is like there might be something if we look at a scale of like thousands of people, there might be a little notch, but it's not. If you go to a classroom and you ask a teacher, and the study's been done, a teacher would never be able to identify a child who's had multiple anesthetic events versus a child that hasn't.
Gotcha.
Okay.
Nicely answered. I'm going to ask another one, Mom, unless you have one.
No, go ahead.
What's the most common fear patients have about anesthesia, and how do you talk to them? How do you talk them through it?
I mean, am I going to wake up, doctor? What if I go to sleep and I don't wake up?
Ooh.
And the answer is, you probably will wake up.
Yeah.
I can confidently say, I haven't had a long career as a physician, but I can confidently say in my short career, I've never put anyone to sleep that because of what I did as an anesthesiologist, they did not wake up. Okay. There have been issues where people have come back for emergencies, right? Gunshots, stabbings, things like that. And it didn't end up well.
Yeah.
But even the super large majority of those patients in emergent situations did survive the operating room. So I just want you guys to leave knowing that anesthesia is safe.
Yeah. Dr. Zack, that sounds good. And what I want to say, when you mentioned the thing about gunshot wound and a stab wound, I mean, that wouldn't even be on your part about the anesthesia part. That's more on the fact of the wound that they suffered and the damage that was done. That wouldn't be on your part.
Yeah, exactly. But me and the surgeon, we work hand in hand in a way, right? They're trying to sew this person up, but the person's losing blood. I'm the person who's repleting the blood. I'm giving more blood. Who's giving medications that are making their blood pressure increase so they can survive, right? That's me, right?
Oh, okay. Yeah. I didn't even think about that part until you broke that down. But I didn't know that until you broke it down.
But one thing with that, have you ever had a patient come back, or I know you're doing this now, but have you ever had a patient come to you and said, I've had an out-of-body experience? I've actually, as a Christian, I'd love to hear your answer to that they saw their body on the table and then they came back. Have you had any patients come and talk to you about that, Christian? I mean,
heard of anyone
that. I have not, and that might be my selection bias in that after they leave the recovery area, I'm usually right back in the operating room with another patient.
Okay.
So it's not very often that I get to then go see them while they're in the hospital or call them after they've gone home, because I just always have another patient. And when they're in the recovery area, they're still a little sleepy and confused.
Okay.
But there is published data about, near death, what they call NDEs, near death experiences, and out of body experiences. So it is actually published in the medical literature. That's not a rare event per se.
Oh, okay. But we're gonna laugh a little bit because I heard you're known for mixing humor with serious education. How do you decide when satire helps learning and when it can backfire?
I've learned that the hard way.
Tell us.
I mean, I remember, so I do a lot of dad jokes. I'm a dad. I like silly things, dry humor. Most of the time people can appreciate that. But there's been some jokes that were a little too dry that people didn't quite get. Like there's this one about the pain scale. I said, we're actually going to reevaluate the way we rate pain. Usually it's 0 to 10, and this pain scale doesn't really work that well. And instead of doing 0 to 10 of how bad you hurt, we're going to start measuring it in megahertz.
Oh man!
I was like, this is a benign joke. This isn't going to go anywhere. And I post that TikTok, and I get like 1,000 comments from people who have chronic pain, and they're like, "You're mocking us. You're mocking the pain scale. You're mocking what we're going through." And I'm like, "Oh no."
Yeah.
That wasn't my intention. And I apologize too to anyone out there too that maybe saw that video or was upset by it. That's not what I meant. But you just the way you see things
Uh,
and you put them out there on the internet isn't
uh-huh.
always the way your viewers see it.
I
Absolutely.
got you.
I'm
I
glad you do
got you.
that, though,
I'm
Doc.
glad you. Yeah, that's wonderful. And talking about medical literacy and it's hard when people are scared and overwhelmed by the situation. What are three simple questions every patient or caregiver should feel comfortable asking in the hospital? I think sometimes when they derobe, but they forget. So with that, what three questions would you think a patient should ask in the hospital?
When you're talking to your doctor in the hospital, making an appointment at any point in time, before you even get there and before you ask these three questions, I want you to have a pen and paper. I want you to have taken notes and highlighted what you want to get out of the appointment before you ever go so that we can maximize your time and my time.
Oh, that's excellent. I always thought patients go ahead, you can finish it. I was going to say take a recorder in because sometimes a recorder or take someone with them. As you mentioned, the wiser group out there, they and even parents from young kids, they kind of forget things. So you were getting ready to say one more thing about that. You said so take paper and pencil, paper and pen with them, and then what are the two things you think?
And with that paper and pencil, ask these questions and write the answers down because
Okay.
more than can you guys hear my dogs?
Oh, no, you're good, man. You're
That's
good.
Okay.
okay. We
Yeah.
have we have dogs on the show.
More than I think. Hang on, I think someone's ringing the door.
Okay,
Okay.
you're good.
Oh yeah. Hang on one second.
Oh,
No
you're good.
problem. No problem.
Dr. Zack is excellent.
Excellent. He's
It's
outstanding.
Joe. What's the check?
Give me time, resident intense
Ask Joe. I'll tell you. It's like 50,000 or something.
burnout can sneak up.
Oh, sorry.
Oh, no, you're good, Dr. Zack. Give me time to look at some questions here.
Okay. So when you come paper, pencil, and then questions to ask, it's going to be why, or I have this issue. What are we going to do about it? Why are we going to do that?
Mm-hmm.
And when we do that, how does that change the treatment?
Okay. Okay. Treatment.
Right. So it's here's my issue. I have a headache.
Mm-hmm.
How are we going to address this? And the doctor says, let's get a CT scan. Okay. Why are we getting a CT scan? Well, because you also have vision problems. So I think that it could be more than just a headache. Okay.
Mm-hmm.
Well, after we get the CT scan, how's that going to change my treatment? Well, if you end up having intracranial hypertension, we
Mm-hmm.
could potentially drain off some of the fluid, right,
Yeah.
from your brain.
Uh-huh.
And if you don't take the notes, though, and I say all these things, you're going to be overwhelmed. You're going to be scared. You're not going to know what I said when we leave this appointment.
Mm-hmm.
And so many times I will go back and talk to the patients or something.
Uh-huh.
And what they think I said to them
Uh-huh.
is not what I said at all.
Okay.
Oh,
Yeah.
okay.
And it's not truly it's my fault.
Mm-hmm.
But it's this I can't explain it. And they're not lying, right? And they're
Mm-hmm.
not, I don't even want to say they're misremembering. It's just, I gave them information overload and they couldn't process it all. And then I said, don't take this medication at the end of this. And then what they left was, I should take that medication. I'm like,
Nervous about
Yeah.
and not quite clear about it. And I used to call on physicians. I sold medicines, Dr. Zach. So I always felt that sometimes in the room doing preceptorships, I noticed that the patient was just lost in the conversation. And I always think the follow up from a nurse or follow up with the family or family member being present with the information that the patient is receiving because looking at the situation in the room, I see they're confused about it. And I
mm-hmm.
think so with that, the follow up and I know doctors are so busy as you are, Dr. Zach, so busy that maybe calling the patient just before a procedure, because see, they might not have fasted, they might not have done the colon cleanse, because I used to call on gastroenterologists. And so with that, not understanding the prep work that they need to do. And that, so do you follow up with patients? Now, I know you're an anesthesiologist, but do you have a habit of checking in your role right now and seeing if procedures are followed up, prep work is done prior to what you have to do?
For most hospital systems, surgery centers, etc., I think we're doing a lot better now as a whole. Not,
Mm-hmm.
every place, of emailing and texting, appointment reminders, instructions,
Okay. Mm-hmm.
doing these, e-messages with, remember you have surgery tomorrow, don't eat after 11 p.m., all
Okay.
these things.
Mm-hmm.
And I don't call everyone, but if I have a critical procedure or a very sick patient or someone that I have any concern about, I often call them the day before to talk to them, to
That's
offer them reassurance, to let them know what to
good.
expect. And I take that time to reiterate things.
Oh, Dr. Zach.
Go ahead, Zach.
Go
Somebody.
ahead. Go ahead. Go ahead. I saw you pause, but go ahead.
I'll keep talking if you let me, so don't.
Oh no,
No, no, no,
you're
no. We
good, Doctor
want
Zach.
you to
No, continue.
talk. We
Continue, Doctor Zach.
prefer
You're
you
good.
talk because you are imparting so much information
Knowledge.
here, and we want to make sure everybody receives it. So go right ahead.
You're good, Doctor Zach. You got the microphone.
So to answer your question, yes, we do that. But still, even with me doing that, with our system checks in place and sending these messages, still it happens. A patient shows up the morning of and they're like, oh, I put creamer in my coffee this morning, because
Mm.
you can drink black coffee with
Oh, I
nothing
know.
else in it. But, we get confused. Or, oh, they took the wrong medication and they didn't take the right one, so now it's totally reversed. And I've had to cancel surgeries,
Absolutely.
Wow. Well, how about if it's an emergency situation and
Ooh,
they have eaten? Like, for instance, if a car accident happens,
very
that
good.
person's eaten. How do you deal with that if it's emergency and they have to have anesthesia?
At the end of the day, if it's an emergency, if you're going to die without the surgery, we
Mm-hmm.
go. It's
Okay.
risk versus benefit. If you don't have surgery and you're going to die, that means the risk is here, but the benefit to having surgery is way up here. So we're gonna take the benefit. We're gonna take the risk and measure it against the benefit, and we're going.
Mhm.
So what do I do? And why? By the way, I want you guys to understand this. You should not eat before surgery, and
Okay.
why? It's not because we're mean people and we want you to starve. I had this young guy about a year ago
Uh-huh.
who he kind of was like me, a little oppositional, defiant, didn't like being told what to do. I could just tell. And I'm interviewing him for surgery, and I'm like, all right, so we're gonna take you back. And he's like, yeah, dude, whatever, whatever, whatever. I'm like, so when's the last time you ate? He's like, I don't know, yesterday. And I'm like, okay, sounds good. It just something didn't sit right with me.
Yeah.
I induce general anesthesia on this guy. We're doing our checks and stuff, and then suddenly he starts vomiting
Holy
a
smoke.
Oh.
massive amount. Yeah, this is really, really bad.
Yeah.
And
Mm,
that vomit, when you vomit, it leaves your stomach, and then it can go right back up and go into your lungs.
mm,
Holy smokes.
And if you get food in your lungs, you can't breathe, right? Like
Yeah.
mhm,
oxygen can't
mhm,
pass through food.
Yeah.
mhm,
So
mhm.
that's why when you eat food before surgery, you have what we call an aspiration risk, food getting down into your lungs. And he ended up doing really well. We were able to suction it out and put a camera down and get everything out. And he did okay because he was so young. But
Mhm.
had he not been so healthy, that could have ended his life.
Yeah.
Wow.
Dr. Zach, with a situation like that, I mean, I can only, I'm just, I'll try to speak, maybe not speak for you, but speak in general. Where when he woke up, I'd be like, you know what? You're lucky to be alive, because all we asked you to do were these following steps, and that could have cost your life by not following that procedure. I get it. It's one thing to be stubborn. It's one thing to have a mental capacity not to know what you're doing, but you did something that caused a serious situation, which you're not aware. And by the way, don't blame the hospital, because we asked you and this is what you told us. So that's where it's good that I mean, that guy's lucky to be alive.
Yeah.
Lucky that you guys were on the ball. That's also a scary situation where you have to take these things serious when doctors, tell you things. But sorry, I'm frustrated with the guy person. That's just me talking, because it's like, hey, man, you being not the best attitude or being nonchalant about it almost could have cost you your life there.
Yeah.
Uh,
Yeah.
But Dr. Zach, do you feel comfortable with what the conversation Brandon just said? Would you go back and tell that patient that, or you just let it fly under the radar?
I probably feel more comfortable than I should having those conversations.
Dr. Zack, I get it. I get it. I definitely get what you mean.
Well, I love that.
Yeah.
So with that said, I wanted to ask you, because we have the internet and everything, how do you handle misinformation online, especially when it spreads faster than careful explanations?
Go check my TikTok and you'll see exactly how I handle it.
Okay.
No,
We definitely,
because
Dr.
we
Zack.
don't. I don't do
Oh yeah,
TikTok,
my
so
mom
I
doesn't do
haven't seen
social
your.
media, really.
What? You're on a pod. You're hosting a podcast, Mama.
Yeah, I do everything. I'm the technical
Well,
guy.
we do all the other platforms except for TikTok. Okay.
Instagram, then check my Instagram. It's all on the same thing.
Okay.
Facebook
Yeah.
too.
Okay. I'll check your Instagram. That would be great. Let's see, Brad.
Doc,
What else you have, and then now we'll go to the lightning round.
absolutely. Dr. Smith, what kind of advice would you have for residents that get burnt out, or for people that are in your industry that get burnt out, and then for students that are in the field that are stressed out, not knowing if they can make it, because you literally have been through it. I mean, you grew up through all kinds of different adversity, and I guess that does kind of wire you differently. But for a person, yeah, go ahead. Sorry. Go ahead, Dr. Jack.
I it's hard for me to give that advice because exactly what you said. I think,
Gotcha.
and not patting myself on the back, but I think I'm exceptionally resilient because, growing up, I saw my dad get shot.
Oh,
I saw my mom covered in blood coming home. And like, I saw these things that probably traumatized me and I compartmentalized, but
mm,
all these things, and then being in the military and doing these things taught me resilience. And I honestly I enjoyed my time in med school. I've enjoyed my time in residency. It was hard. But I did well with these things because in comparison to what I'd been through, this was great. The fact that I was getting paid to learn in a sense, right, was awesome.
yeah. And then
Um,
also, sorry, Dr. Jack, I didn't mean to cut you off. I did not mean to. Go ahead. Go back to what you're saying.
but I guess to those people, I would say stay focused. Remember why you chose this path because it's a long, hard path.
Mm-hmm.
Focus on that reason and that purpose. Don't lose sight of it. It's all going to be worth it. It truly, truly is. Unless your focus was on money, then you're going to be sorely disappointed.
Absolutely. Absolutely. Dr. Zach, if you could go back and tell your 18-year-old self anything, what would it be?
Don't be so cocky.
Yeah.
Calm down. It's going to be okay. Listen to others more than you speak.
Mm-hmm.
I
Absolutely.
think so.
Okay.
That sounds good to me.
But before you do that, Brandon, you have one more question?
Oh, no, go ahead. You're good.
Yeah. Dr. Zach, I think about policies and I think about systems several times, and I've done that in my life and now too. What one policy or system change you believe would most improve patient safety? I believe in safety from my DuPont years, and or the patient experience, and why?
Okay. Now this one, well, you know what? This actually should not be controversial at all.
Mm-hmm.
So I'm just going to say it how it is. And I don't know how to fix it, but our mortality rate for Native American women and African American women are almost 3 times that of Asian and Caucasian women,
Mm-hmm.
especially when it comes to pregnancies. I can't tell you exactly why that is, but
Mm-hmm.
I can tell you, even when you have a highly educated, wealthy African American woman,
Mm-hmm.
her chances of dying during childbirth are almost 3 times higher than that of an uneducated white pregnant lady.
Mm-hmm.
And actually Native Americans even more so than African Americans. And my wife's Native American, right? So that's really close to my heart. She's a tribal member, and I don't know what needs to change, but it needs to change.
Yeah.
That is something that's unacceptable in our society and day and age.
Well,
Dr. Zach,
I'm
thank you for
so glad you mentioned that,
yeah.
Dr. Zach, because I think as an African American, well, as a Black female, I'll just say Black female, I don't feel that they listen. I don't think that systems listen when we're trying to tell them. I remember my first child, and I was in the hospital, and they had to do emergency C-section, and I told my husband, I said, Dave, I feel like I'm going to pass out. I feel like I'm going to die. And it was panic on the room. And I started telling everybody, I said, oh, I started talking. I said, listen to me. I feel like it. I felt it. I felt something was coming over me and I thought I was going to pass out, and they took action, but they're not listening when patients are saying, especially Black people are saying, and whether it's female or male, but they're not listening when we say something is wrong. It's like it's overlooked, not really taken seriously. So I just want to share you with the audience, and they didn't know that personal experience I had. And so with that listening, I remember my husband running out the room, and he called his father up. He said, we got to pray. We got to pray for Carolyn right now. And so he called in the prayer warriors and to come in. And I knew God had put his hand on me at that time, because I started to, they were doing some things, but with his prayer and his daddy, I always tell his dad is a bishop, was bishop of a church. He's gone on now to the Lord. I said, my father-in-law usually has a certain position he used to take. And I said, he got off that throne for a minute and he got back on it when he heard that I was in distress. And so with that, I'm so glad you're bringing that point up. I didn't know that asking that question would move to this conversation, but I'm glad it did. And so maybe listeners out there, hospital systems will listen to, because we have all over the world now, with 13.8 million people, will listen to what we are saying, to speak up, get clarification. If you're not feeling good, say, listen to me. You have to listen to me. In fact, sometimes advice I've given people, if they have something going on, no one's paying attention, say something's going on with your heart. I tell you, they'll take you back in the emergency room in a minute. They'll take you right on back.
I got
Just
chest pain and shortness of breath.
Say what? What did you say?
Say that again, Dr. Zack.
If you want to go back to the ER right away, say I got chest pain and shortness of breath.
Okay.
That's exactly right. That's what I tell them, Zack. That is exactly right. You will not be sitting out there in the waiting room. Okay, all right.
Doctors.
Okay, all right. And looking ahead, what kind of doctor educator do you want to be 5 years from now? And what projects are you now most excited about to build?
That's a good question. If you would have asked me a year and a half ago, it would have been a different answer. Because, like I said, I wasn't even on social media a year and a half ago, and then I went last December of 2024. I was like, let's just start posting, and I went from 0 followers. I think I have about 280,000 across all my 3 major platforms. So before then, I would have been like, I just want to kind of teach residents and stuff. But now you ask me, and I want to be, I'm going to be honest, I want to be like a Dr. Mike. I want to help teach the public, and I want to help. I'm really interested in policy and advocacy as well. And I'm actually doing a dedicated advocacy rotation, which is the American Society of Anesthesiologists is funding a trip for me to go to Washington, D.C. and advocate for certain policy changes and stuff. I mean, that's going to happen in May of this year, so I'm really excited about that. But that's what I want. I want to use my platform for change, for advocacy, for policy, education.
And you're such a natural at it. I want to tell you, you're so great at it. And I feel, and I know our listeners do, feel so comfortable in your explanations, the way you present data. And I want to thank you for that. So, Brandon, you go ahead with what you have to say, and then let's do this lightning round.
Yes, ma'am. Dr. Zack, before I get to the lightning round, I'm going to get to that. One, you are always welcome on the show.
Thank you.
You just shoot me a message. Hey, Brandon, I'm down to come back. We'd love to have you back on here anytime, because I like the way you carry yourself. I like the way you speak. And then I enjoy your comedy too. So you are a Dr. Zack. And then 2, I want to say, after you, anytime, let me know. Also, after you go to that, the summit that you're going to in Washington, D.C., we definitely want to have you back on so we can hear about that too.
Yeah.
As well. But you can hit me up before then. And then the other thing I want to say too is I always ask God to help me find the right people. And through this, everyone I have reached out to has been the right person for exactly what we needed to help the most people and do the most good. I wish that God sent me where I can do the most good. In this instance, with finding you on here has been one of those examples of people that I thank God for. So I just
want. Did you find me, by the way?
Literally. So I'll make it real short. Believe it or not, a close family friend of mine was involved in a horrible ski accident on Saturday, and his brother, who's a Marine, was in kind of, just not shock kind of too, but he was looking for all the resources that he could to help out his brother, who has a C4 fracture with spinal cord injury. And so what I did was I I have a lot of friends that are doctors, but specifically he was looking for neurologists, and that's one thing that I don't have so much. So what I did was I looked up hashtag neurologist, and I saw you on there, and I'm like, hey, let me DM Dr. Zack I looked at your profile. I was like, hey, I like what he's talking. Let me invite him onto the show because I think he'd be a good person to have. Because I have the reason we have people in 73 countries and 800 cities around the world, because I have the numbers, is because of me going out and finding these people like that. So having you on was for a specific purpose. So I'm glad that we were able to get you there.
It was a God-driven. It's
exactly. And God brought me to you, Zack. So
that's God-driven. I'm
that's the
already in
most
the
important
world.
thing.
Here
And
we
you
come,
answered when I
Dr.
wrote
Zack.
you. So,
well, I hope your friend's doing okay.
Yeah, he's got feeling back in his arms and hands now, which is a blessing. So it's a long road to recovery, but we're taking it one step at a time. And then now is the lightning round, Dr. Zack, and I appreciate that as well. Coffee, tea, or water? What should you go to?
As an anesthesiologist, it has to be coffee, but probably really water.
Okay. One medical myth that makes you say, Lord, help us.
Oh my God, a medical myth that vaccines don't work.
Ooh, really?
Well, it's almost, maybe it's because of social media, right? But I almost see more people who are against vaccines now than are for it. And what's happening? Or that Big Pharma is paying me money. I'm still waiting on my check.
Yeah, absolutely. The biggest Hollywood got medicine wrong moment. This happens in TV. It could be in TV and movies, but hey, Hollywood got this wrong.
Grey's Anatomy.
Oh, yeah.
The entire show. I haven't hooked up in a call room a single time.
Oh, yeah. Lose your job because of it, right? Yeah. Okay, favorite piece of advice you've ever received?
Oh man. Ooh. There's so many. My favorite piece. I like this quote. I think it's by, Jeremy Dean, who said, growth begins at the end of your comfort zone.
Ooh, we like that. I like that a lot. One of the things we talk about.
That. Let me write that one down.
Most underrated life skill for adults.
Being early, time management. That's everything.
Absolutely. A habit that keeps you sane during stressful weeks.
A habit that keeps me Oh my God. You said sane?
Yeah, sane.
I'm not sane. I don't know. I can't answer that one. Pass. I don't know. Let me know when you figure it out.
I definitely will. One thing you wish every patient knew before walking into a hospital.
Be on time.
Okay. Yeah, absolutely. Absolutely. Best comfort food after a long day.
I love macaroni and cheese. It's probably just, I don't know. I love mac and cheese.
Okay, that's your go-to. That's your comfort food.
Yeah.
If you weren't
Velveeta, it's got to be a Velveeta based. I'm just gonna say.
Yo, man, we gotta help you out with some Southern cooking here, Dr. Zack.
Yeah, Brandon's a great macaroni and cheese.
Yeah, that's my specialty is macaroni and cheese. And I definitely don't use Velveeta, but I understand where you're coming from. If you weren't in medicine, Velveita? Sorry.
I know it's cheese product. I get it.
Okay, absolutely.
It's comfort. You said comfort.
I got you. All right, I'll forgive you on that, Dr. Zack. If you weren't in medicine, what would you be doing?
Engineering, electrical engineering. I got my degree in that, and I'd be developing medical devices, and I'm still doing that. Actually, I got some projects I'm working on. But
okay, awesome. I have no doubt you'll be successful in that too. What makes you laugh even on tough days?
My wife, my kids.
Hey man, I like that. You have two boys, boy and girl.
2 boys.
Okay, nice. How old are they right now?
3 and 5.
Now, how do you manage?
Very blessed. Very blessed.
Absolutely. Sorry, I didn't mean to interrupt you.
Okay.
I'll say, Dr. Zack, you got to be tired, but you still make time, huh?
Yeah, I'm not balancing it well.
Okay. A book, a show, or a podcast that you would recommend right now to people?
A book, a show, or a podcast. Okay, so we'll just go pure entertainment here. For All Mankind. It's an Apple TV series. I think it's underrated.
Yeah.
And it's amazing.
Dr. Zack, I was so close to getting on that show. I auditioned for it. One of my biggest regrets is not getting on that. And then also we had the casting director of that show was on our show as well.
Really?
Yeah.
Mm-hmm.
I'll send you the episode.
Yeah. I applied to be an astronaut.
Okay, yeah, that'd be dude. That thing is that show's awesome.
Yeah.
How about a podcast? Any podcasts that you like, or any book?
Yeah, I'll say Rated RX. It's a podcast started up by my buddy. He tells pretty much crazy stories from the pharmacy.
Okay.
Like, people going to the CVS window saying, "Hey, will you look at this rash on my butt?" And it's like, you're at Walgreens right now. Calm down, buddy. It's a
Yeah.
pharmacist.
Okay, absolutely. I'll have to check that out. And then a book. Do you have a book?
Book. There is, let's see. There's a few. I'd say A Hole in My Life by Jack Gantos. I think that's an underrated book. The Heaven is for Real. That's a good one. That's a cute one. There's a near-death experience journey by a neurosurgeon who actually had a near-death experience who found his faith through that. That one's I can't remember the name of that one, but that one's good.
Okay, that sounds good. One word you hope patients will use to describe you as a doctor.
I hope they think I listened. Listener.
Like that. Quick either or. I think we already did this one, but early morning or late nights, if you had a preference of, I guess, maybe work or.
Oh, I don't know. Can I do midday? I'm a midday guy.
Why not, man? That kind of is the best time. One non-negotiable value you live by.
Integrity.
Oh, I love that one.
Okay. And then you said this earlier a little bit by accident, but finish the sentence with buckle up means to you. What does buckle up mean to you?
Be resilient. Yeah. Let's go.
I like that. Dr. Zack.
Before we finish, Brandon, two things came to me, and I want Dr. Zack to answer these two. Dr. Zack, first of all, congratulations on great job on the podcast. You are outstanding, so knowledgeable, and God has truly blessed you with that knowledge. But one word I want you to describe: great teamwork in the OR.
One word to describe teamwork in the OR?
Great to describe great teamwork in the OR. If you're in the OR, what kind of teamwork do you really want? What describes
it? It would be, it's seamless. When the best operating room I've been in with the best teamwork was a room where no one said anything during an emergency. We all did exactly. The patient's heart stopped. I'll never forget. Someone said asystole, and we proceeded and did exactly what we needed to, like an orchestra who had trained. And that was, I'll never forget that day when I just clicked in and saw that happen. And I was like, wow.
Oh, I love that. And so I wanted you to finish this sentence. Patients deserve
better. They deserve better. I don't know what we're doing right now, but whatever it is, it's not enough and it needs to be better.
Oh, okay. Well,
Dr.
all I can do is wipe my brow and say, well done.
Absolutely.
This was outstanding. Anything you want to ask of us?
Oh, yeah, if you had any questions.
No, thanks, guys.
Okay.
But
Dr. Zack, you are more than welcome here anytime.
Puppy, look at the puppy in his. That's because we have an audience of children, and they love animals, and we have a portion that deals with animals. Please introduce your little pet, your child, and tell us.
This one's Gracie. We got her when I was in med school. We adopted her from a shelter.
Oh, Gracie. Oh, how old is Gracie?
She was probably 4 or 5 when we got her.
And what breed is she?
She's definitely a Yorkie something. We're not sure. If you guys know, let me know.
Okay. Well, Gracie, so glad to see you. Welcome you to the Buckle Up podcast with our other little viewers that come out there to watch our animals part of the show. Well, listen, I tell you, first, I'm going to say, and then Brandon can end. I want to thank you so much. Lord, you were truly, Lord had us like a magnet. I had Brandon find you in this world of people. Look how God just blessed us to all come together today. And I'm so grateful and so thankful for what you brought to the podcast. Listeners, I hope that you will enjoy this. I have enjoyed it. And Brandon, you can go ahead and finish up. And by the way, thank you. Mama Rush wants to thank you so much for all the information you imparted and impacted. Okay.
Dr. Zack, Mom summed it up. As I said, thank you for just being who you are as a doctor, being an amazing human being. As even answering my message when I wrote you, that means the world to me too. Because you didn't know me, you didn't owe me anything, but you said, heck yeah, let's do it. That means
I think specifically I said, let's go was my first response.
Oh yeah, that's it. Yeah. And that's the kind of people I appreciate. That's just what I'm drawn to too. So I appreciate you. Dr. Zack, email me a photo that you want to use for your podcast station. I'll have this done in a few hours.
Oh, cool. If you guys are ever, where are you based out of?
So right now I'm in South Carolina. That's where the show's based out of, but I'm gonna be in New York City in the next 3 months. I was in Los Angeles before, but now I'm moving to New York City.
Oh, okay. Well, if you're ever back in SoCal, hit me up. Okay, we'll get coffee.
Absolutely, brother. Take care, brother. All right, man. Thank you so much, Dr.
Thank
Zack.
you. Thank you. So let's do what we do. Let's clap.
You're
Great job,
phenomenal,
great
Dr. Zack.
job.
Have a blessed day.
See ya.
All righty, let's see. He was phenomenal.
Oh,